in the same pan something with peanuts in it 2 days before. And so everything is a trap, and everything is a potential killer of your child. I really focused my mind on it, but and I was focused on, okay, what are we going to do to treat it and to prevent him from getting sick? But I also, my mind immediately went to the place of, why is this happening? 5 of my 7 kids have allergies. What happened? Something happened. And it appears to have happened sometime around 1989, 1990. So you have to look at an environmental toxin that became ubiquitous during that year across all the different demographics, from Cubans in Key Biscayne, Miami, to Inuit in Alaska. Everybody started getting these allergies at that time. And why have there been no studies on that? Why are not people looking at that? Why isn't the entire scientific community focused on saying it's a very easy studies to do? You make a list of all the potential culprits that fit those criteria, and then you begin eliminating them. But those studies have never been done. We are going to do them now, and we will identify what is causing these allergies. The allergies, as I said, they've exploded. CDC, they were so rare that CDC did not even start counting them until 1997. It's just an obvious question. And we have an institute. I wish I was supposed to watch Jay speak. This program was running a little late, and I have a really tight schedule today. But in his agency, there's a sub-agency that was run by Anthony Fauci called the National Institute for Allergic and Infectious Diseases. It's supposed to study allergic diseases. And my question is, why didn't they immediately look on this and say, why are there suddenly all these kids with these allergies?
Food allergy has been proliferating, and it's very much a public health crisis that has flown under the radar. So I'm so excited that together we can really shine a spotlight on what needs to be done to change the course of this disease. You've said that thanks to President Trump's commitment to make America healthy again, your leadership at HHS has delivered more public health wins than any previous administration. Can you walk through some of these successes, especially as they relate to food?
Specifically with food. I guess one of the most important things is the GRAS standards. GRAS standards, the acronym GRAS means generally recognized as safe. And when the FDA began regulating food in the 1940s, they were regulating contaminants in food, since Upton Sinclair did his book, The Jungle, in the 1920s, and FDA was started as a result of that. They began regulating ingredients of food in the 1940s, but they said, well, we don't want to regulate ingredients that have been around forever, like wheat and flour and yeast and sugars. So we don't want people to have to do new sets of studies on those kind of foods, because they're proven. They're generally recognized as safe. So they developed that category. And if it is an ingredient that's been around for a long time, we're not going to force you to do the studies. That category, as the agency became captured by the food industry, that category was hijacked by the food industry, so that, and every new ingredient that was developed by any food company was automatically generally recognized as safe. And the burden of proving, the burden fell on the consumer and the government to prove harm if you didn't want the ingredient in the food. And the government doesn't have the money to do those tests. And so it just opened this loophole that now we have 10,000 ingredients in our food that are illegal in Europe. And Europeans have 400 ingredients. We have over 10,000. And we need to now, so we're doing this, closing that loophole, which we have to do with regulations. So that takes about 6 months, but we've already started that process. And then we're going to go back and do kind of triage where we have the power to force the companies that are making existing ingredients to go back and prove that they're safe. And we're going to take, we have a high priority list of priority ingredients that are the most common ingredients we're going to make them test first, but we're going to go now back through the entire list and make them start testing it and telling us whether they're really safe or not. We're doing the SNAP waivers. 12 states have already gotten SNAP waivers, which we're encouraging. There's 6 states in line for them right now. These are food stamp waivers. About 10% of our food stamp expenditures go for soda drinks, and about 8% go for candies and sweets. And so we're giving the poorest Americans diabetes from when they're little. And we are paying for the diabetes through Medicaid, so it makes no sense. And so the SNAP waivers allow the states to step in and say, in this state, we're not going to pay for soda drinks, we're not going to pay for food. Some of them are doing ultra-processed food and other things under SNAP. So we're getting rid of the food dyes, all of the petroleum-based food dyes. We're doing that very quickly. We have this Operation Stork Speed to clean up baby formula. We're ending the war on saturated fats in this country, so we're going to publish dietary guidelines that are going to stress the importance of protein and saturated fats. And those will come out, I think, next month. And I think that will really revolutionize the food system in the country and the food culture in this country, because it will be implemented almost immediately in the military and in federal institutions, and then next year, we're going to be very aggressive about getting good food into the schools, the elementary schools, the public schools of this country. Those are some of the things that we're doing. We have a list of 100, but time is limited.
Well, you're moving at breakneck speed, so we're all appreciative of it. But you mentioned the military. 78% of our children are ineligible to serve because of chronic disease, and food allergy itself is an automatic disqualification from service. So food allergy touches on so many aspects of our society. When you spoke at the National Governors Association over the summer, you challenged Governor Polis on the root causes of peanut allergy specifically. Can you tell us a little bit about what you said in that exchange?
Well, Governor Polis had advanced hypothesis about one of the causes of food allergies, a very popular hypothesis. In fact, it's one that Marty McCary talks about a lot, which is that maybe the peanut allergies are associated with the lack of peanut exposures to children. I guess in the 80s and 90s, that parents were told not to expose their children to peanuts, and that it was the lack of exposure, that early exposure, that maybe is triggering peanut allergies. And people talk about Israel, where apparently there are very few peanut allergies and where there's early exposure to peanuts. To me, that is not a convincing hypothesis, because number one, in my own personal experience, was my house was so filled with peanut butter, and I was eating peanut butter 2 meals a day, and my wife, when she was pregnant, was eating peanut butter, and the kids were given peanut butter from as soon as they could chew food, and yet we still had peanut allergies in our house. And that's kind of anecdotal, but more importantly, peanuts really were not eaten by anybody until George Washington Carver came along, and really they didn't, there was no mass consumption of peanuts until after peanut butter was invented. That was in the 1920s, but really during World War I and World War II, it became a source of protein when there was, when there were restrictions on other sources of protein that people could get a hold of. And So suddenly you had a whole population that was eating peanuts, and yet there were no peanut allergies. It doesn't make any sense to me that a deprivation, that a peanut allergy is just is from a deprivation of peanuts. There's many countries in the world that only started eating peanuts recently, and you didn't see huge waves of peanut allergy. So that doesn't make a lot of sense. I mean, one of the things that I said to Governor Paul is that we need to look at aluminum adjuvants in vaccines, which fit the timeline perfectly. The increase of aluminum is in lockstep, which began in 1989, which is in lockstep with the expansion of peanut allergies. We don't have the science to say this is an effect or not. There may be other things like, for example, pesticides that fit the same timeline. But those are the kind of things that we have to look at. The aluminum adjuvants are designed to increase the immune response and to hyperactivate your immune system. And they do that along the they cause Th2 inflammation, which creates IG2, which the gentlemen up here were talking about mediated pathway. So when you give, there are many studies that show when you give animals aluminum adjuvants, they do develop allergies to proteins that are in the vaccine when they're given that, or that they're exposed to in the ambient environment. And so that's something that we need to look at. And there's a couple of scientists, a guy called Anthony Mawson from the University of Mississippi and another scientist called Gowlings from Europe that have looked at allergies in vaccinated children versus unvaccinated children. And I think Mawson's study found that vaccinated children had 30 times the rate of allergic rhinitis as unvaccinated children. And the hypothesis is that when you get that aluminum vaccine, if there's a Timothy weed outbreak at that time, and maybe that might give you a lifetime allergy to Timothy weed if you're sensitized by the aluminum at that time. But again, we don't know. I mean, the problem is there haven't been any human cohort studies. There's lots and lots and lots and lots of animal studies. Why didn't CDC or NIAID do those human studies? Because it's pretty easy to figure this out, and we will figure it out.
In general, it seems that food allergy is the perfect storm, right? It's multiple factors that have come to a peak and a crescendo in this generation. To your point, in terms of early introduction and exposure, the only thing I craved my entire pregnancy was peanuts. I ate cans and cans of peanuts, probably too many peanuts, more than any human being should eat. But nevertheless, we talk to hundreds and thousands of families every year in the work that we do, and all of them have done early introduction. And it works for some, it doesn't work for others. And for the kids who are already living with food allergies and for the adults who are developing allergies later in life as well, half are now starting in adulthood, we need to look at all these factors that are contributing to the rise in the disease.
Yeah, there may be many factors. There may be only one. We don't know. Why don't we know? Because there's been basically malpractice in the government-funded scientific community. Why wasn't this a question that was being asked, that was being demanded? As soon as this allergy started to appear, why weren't we putting out, requests for proposals saying, tell us why this is starting? And instead it became a verboten subject. You weren't allowed to study it. And science warned each other against studying it. And so, we're going to study it now. We're going to break that omerta. We're going to end the taboo, and we're going to find out what's causing it.
It's a very exciting moment. Food allergy is in much needed research, certainly. What do you see as the single most decisive step that this administration can take to end the childhood chronic disease epidemic?
I would say if I had to guess about the most important exposures, I would point my finger at ultra-processed food. And again, it's a criminal that we do not have a clear answer to that right now. But there is a lot of accumulating scientific data and scientific studies that, and also just common sense that point to ultra-processed foods. There's all kinds of, our kids are swimming around in a toxic soup, microplastics, EMF radiation, and then, pesticides, and, all of these toxic exposures that are affecting them from birth. And so addressing, though, in a specific sense, President Trump has asked us to address those, to identify what the culprits are, and then to eliminate them. And then I think, in a broader sense, we need to realign, we need to make sure that we're getting gold standard science, and that the science is not responsive to prejudice or to bias or to official orthodoxies, that people are allowed to ask questions, and they're allowed to question everything, and that there's nothing that is off bounds. I think Jay Bhattacharya is working really successfully to redirect, to recalibrate the compass at NIH where people feel safe researching formerly taboo subjects. And that's what he said to me from day one, is we need to break the taboos so people can ask questions. And then, I think the sort of the last category is what we're doing at CMS, which is to realign the perverse incentives that incentivize everybody, the hospitals, the doctors, the scientists, the government, to keep people sick. We literally are incentivized to keep people sick. You can make more money by keeping the hospitals make more money, the doctors make more money, the insurance companies make more money. Everybody's making more money for keeping us sick. No matter how good-hearted you are as an individual, those incentives will affect societal behavior. And what we're trying to do is to realign those incentives so that you can do well by doing good, that people are going to be rewarded for making their patients better rather than for giving them a bunch of tests and then, making their money on the friction or giving them interventions that they don't need. That we're all, incentivized to make Americans healthier.
Absolutely. I mean, the economic impact of food allergy alone, every 3 minutes someone goes to the emergency room. 30% of food allergy moms are dropping out of the workforce, $30 billion on direct medical costs, and the list goes on and on. So I think if we start with food allergy, and really we talked earlier today in the program about gut microbiome health and thinking of food allergy as the canary in the coal mine for chronic disease that often presents in the first 2 years of life, earlier than many other childhood conditions such as autism, juvenile diabetes, asthma, et cetera. So we can figure out what's going on with food allergy, crack that nut, no pun intended. I think it will have lifelong gut health implications.
Yeah, and I think when we figure out the answer for food allergies, that there's a whole list of atopic diseases that exploded simultaneously in lockstep with food allergies. Eczema, or allergic dermatitis is called, what it used to be called, which again, I didn't know anybody with eczema when I was a kid, and now, you have a whole generation that has eczema. Anaphylaxis, atopic diseases. And I'll say one thing about, the residual food proteins in vaccine, because the science suggests that aluminum alone will not cause allergies, but there are but when it's combined with a protein, if it's a latex protein or a dairy protein or a peanut protein, that's when you get this heightened immune response. But in the 1990s, there were a lot of anaphylaxis cases suddenly exploding in Japan. And they traced it to gelatin in the live virus vaccines and the MMR vaccines and some of the other vaccines they had over there. And by 2000, they had removed it all, and the anaphylaxis dropped dramatically. And so, I think we do have human models where you can look at you can look at sort of broad allergic reactions that take place across an entire society that are linked to the vaccine schedule. And there's no question about the size. There's all kinds of studies done on the Japanese example. And so it's just another piece of evidence in the puzzle that, we are now going to put together at NIH and at the other agencies and figure out exactly what is causing this.
Well, we're so grateful for your leadership and for the beginning of putting the puzzle pieces together. So thank you so much, Secretary.
Thank you.